Hello everyone and welcome to module number 6. This week we are looking at the nephrology unit, and that sometimes goes hand in hand with urology. So you'll kind of see some of the same pieces maybe that you've already learned or that you will be learning in a future course. So with that being said, let's go ahead and we have 2 chapters this week. We have chapter 2, which is only on page 29, so I feel like that one's an easy one for you to read. We'll talk about what only section you really kind of need to look at with that. We're also going to look at chapter 31, which is looking at and focusing on the urinary system, which does kind of deal with nephrology. So without further ado, let's go ahead and take a look. So chapter 29 is dealing with kind of nephrologic history. So dealing with kind of the history of how this unit or how this subject, how this body system kind of came to be. So chapter 2 will deal with a whole lot of different medical practices, and it will give you the breakdown of all of the different specialties within the medical world. You only need to focus on that of nephrology. Now, it's important for you to know that most specialties do allow and do have medical assistants working within their offices, as most of the job opportunities for medical assistants really will be in an outpatient care setting. So when we're talking about nephrology, it's good for you to understand that nephrology is dealing with the study of the kidneys and the associative disorders. The number one provider that you'll be working with is called a nephrologist. Now, nephrologists are skilled in both medical and surgical treatments of the kidneys, meaning that they can do dialysis or any sort of kidney procedures. Now, the kidneys are the primary organ of the urinary system, so as I've said multiple times, it does kind of go hand in hand. So let's go ahead. Again, that was chapter 29, that little piece that you needed to learn about. So we're going to talk about chapter 31, which is dealing with the organs that are associative within the urinary system. Again, we have the kidneys because they are the major piece of that, but you also have ureters, urinary bladder, and urethra. So what I'm going to do is take just a few minutes to kind of break down each of those for you so you get a better understanding of what all is kind of encompassed in those organs. And we're going to start with the kidneys. I feel like this is the big one we need to start with, as this is what your whole unit is on this week. Now, the kidneys are 2 bean-shaped organs located at the back of the abdominal cavity. The way I like to explain this to people is, we all know that stance that women have when we get angry, where we put our hands on our hips and we kind of do like the foot out thing, right? But where your hands hit on the back of your body, that's actually where your kidneys are. So that's an easy way to think about that. The kidney has both internal and external parts. The external structure of the kidney is called the hilum. This is the opening for the ureter, which connects to the renal pelvis, which collects urine. Internal structures of the kidney are separated by 2 parts, either the renal cortex or the renal medulla. The renal cortex is a soft, dense area that is considered the outer layer of the kidney. The renal medulla is found deep within the kidney and helps to form the renal pyramids. Now, when we talk about the kidney, there's a very big key player that we need to talk about, and that's called the nephron. The nephron is a functional unit of the kidney, and each kidney has over 1 million nephrons in it. So there's a lot of little guys doing a lot of big work in your kidneys there. Next, we have our ureters, and these are 2 muscular tubes that carry newly formed urine from each kidney down to the bladder. Each ureter is typically about 8 to 12 inches in length and has 3 layers. Now, Urine is made throughout your entire day. You don't know that it's being made. It's kind of part of that autonomic nervous system, if you remember from the previous week. But every about 10 to 15 seconds, your ureters carry a little bit of urine down to the bladder until it becomes full. And that's when you actually feel like you need to use the restroom, where you feel like your bladder is going to explode. But it's actually collecting urine throughout the entire day. Next, we have your urinary bladder, and this is really a hollow muscular sac that is a reservoir for urine. It's found in the front of your pelvic cavity, and your bladder can actually hold quite a bit of fluid. It can hold about 16 ounces, which is about 500 milliliters of urine, and you typically feel the need to use the restroom when your bladder is about 300 to 350 milliliters full. Again, your bladder has several layers that it is made up of, but it has the four main ones that people mostly need to know about, which are your innermost layer, the lamina propria, the muscular purpura, and the perovascular fat. And the final piece, we have your urethra. Now, this is a tube of muscle and membrane that is responsible for voiding the urine. It extends from the bladder to the urinary meatus. Now, the urinary meatus is actually that kind of opening at the end of the urethra, or where it can actually be voided out of the body. For both men and women, your urethra is different sizes, just because the genitalia in that area is longer for men than it is for women. Okay. So now one other thing I want to talk about that I feel is really important, besides just the structure, is knowing a couple of different things. We want to know some of the common diseases. So here I have a list of them. We have incontinence, dysuria, a UTI, which is actually probably the most common one. We have renal colic, renal failure, renal artery stenosis, and vesicochorial reflux. Now, all of these are really, really important, and I highly encourage you to read them. And not only here, but in your book. One other thing I want to talk about is your body produces urine, okay? And that urine starts to be formed in the kidneys, okay? That formation of your urine is broken down into three parts. It is filtration, reabsorption, and secretion. Now, urine consists of 95% water and 5% solid substances. Those solid substances can be things such as salts, bacteria, leftover material that didn't get filtered out by our kidneys, things like that. On average, a normal person should urinate somewhere between 1,000 to 1,500 milliliters per day. And urine should be a normal clear or straw yellow color. Anything outside of that is really considered abnormal. A couple of the diseases that I want to talk about that aren't up here is a big one is called polycystic kidney disease. This is a disorder in which multiple clusters of cysts develop, generally within the surface of the kidney. The cysts are typically benign or non-cancerous. And if your patient has PKD, or polycystic kidney disease, they'll typically have high blood pressure, low back or side pain, abdominal pain, and an increase in the size of their abdomen. They'll have a lot of blood in their urine, and they'll have a lot of headaches. Now, in order to treat this PKD, you have to be able to kind of drain the cysts that have developed. Sadly, because there are several cysts, they can never completely be removed or completely drained. This is something that is very chronic, and people will have to deal with the rest of their life. Another one I want to talk about that is not up here is called cystitis. This is an inflammation of the bladder that is normally caused by ascending UTIs. So if you have UTIs repetitively, it can very easily happen that you'll have cystitis. Some of the signs and symptoms of this disease are urinary frequency and urgency, itching or dysuria. So dysuria, if you don't know, means painful urination. You'll have dark, painful urination that will be cloudy or bloody, and it will have a very foul odor to it. Typically, we can treat these with antibiotics. All right, I want to now talk about just your homework for this week. So this week for your homework, you do have one discussion post like normal. That discussion post, you will need to take some time and really look at and research the kidneys. So your kidneys play a very, very vital role in everything that you do in your entire life as your body needs it to function. If you don't have proper kidney function, other organs in your body will soon start to be affected and may even shut down. So what you need to do is research and find out exactly what destroys your kidneys. Is it certain types of medications that you take? And if so, what medications? Don't tell me classifications. Tell me what medications. Could maybe certain chemicals that we put into our bodies be hurting our kidneys? Again, if it is, tell me what kind of chemicals. And are there any genetic or hereditary disorders or diseases that could affect the kidney? And if so, what are they? And what can you really do to take better care of your kidneys and protect your kidneys? So there's quite a few questions that you need to answer. Those are in your the actual assignment details. I just like to talk about them here so it's not the first time you're hearing them when you get to your homework assignment, your discussion board. You also have one quiz this week. I'm going to back up just a minute. Make sure that your initial discussion post for this week is completed no later than November 7th by midnight. And you need to reply to at least one classmate no later than Saturday, November 11th by midnight. Remember, reply posts to the instructor do not count for the grade, and please make sure you're reading the discussion board rubric before you go into actually doing your discussion board. I would also encourage that you are looking at prior discussion board rubrics and how I've graded you, so if there are errors, you can fix them. Now let's talk about your quiz this week. One quiz, 10 multiple choice questions, again a 10-minute time limit, just like they have been up until this point, and that will be due no later than Sunday, November 12th by midnight. All right, guys, if you have any questions, comments, or concerns, as always, please make sure that you are reaching out to me, either the course messaging in Blackboard or reaching out to me via email. That is my email, is course messaging, or giving me a call on my direct line to the Rockford campus that you can find on your course homepage in the top right-hand corner. I hope that you all have a wonderful Module 6 dealing with the urinary and nephrology systems. I know that in your lab classes you'll probably be dealing with a lot of urine, so make sure that you are prepared for that. And have a wonderful week, guys. Bye-bye.